three things are not.
Correct.
I mission. It didn't. I mean,
Okay.
I
I think we're all ready. Mr. Kern had let us know earlier that he's gonna be a little late, so he will be getting there eventually, but he's late for now. So I will call this meeting to order and roll call, please.
Mr. Kern, Mr. Rainier,
Present.
Mrs. Psalm, present, Mrs. Young, here, Mr. Sharp.
Here. Pledge allegiance. Sarah, would you like to?
Sure. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So the first item is to approve the agenda as presented, although I will have to make note of an amendment. Items 1, 2, and 3 of new business are not ready. So we haven't seen those. So items 1, 2, and 3 are not happening.
Say that again now.
New business, items 1, 2, and 3 approved the permanent appropriations, approved transfers, and approved capital. We haven't seen them yet,
So those were not good.
so we're not doing those tonight.
Gotcha.
So,
Sorry.
so in terms of the agenda as presented, it is as presented minus items 1, 2, and 3 of new business. All right, so is there a motion for that? So move seconds. Robin seconds, discussion. Roll call.
Mrs. Young? Yes. Mrs. Psalm? Yes. Mr. Rainier?
Yes.
Mr. Sharp?
Yes. Consent agenda, which includes the minutes from a previous meeting. Item 2, approve certified substitute list number 2 as submitted by the Fairfield County ESC for 2021, which is attachment 2. September list as submitted by the Pickaway County ESC, attachment 3. And add additional sub to the Fairfield County ESC list, Brooke Taylor, for approval. Item 3 is accept resignations and retirements for Kimberly Miller, cook, cashier, effective 8/12/21, for her verbal resignation to Mr. Dick. As it pains me, resignation of Mr. J.B. Dick, superintendent, effective August 1, after our school year. Item 3, Jennifer Goss, educational aide, effective 9/10/21. And then finally, item 4, approved donations, $10,000 donation from Midwest Fabricating for the new scoreboard being installed. Donation of $750 each for athletic banners from Taylor Feller Funeral Home and J Mills at J Mills Realtor. Buckeye Toyota, an amount of $750 for the scoreboard, and an anonymous donation of $30 for athletics. Obviously, thank you to all those donations. Thank you to those who decided to move on or retire. Obviously, we got a year left for JB. We'll try not to drive him insane during that time, so he can
Glory there.
so he can officially enjoy his retirement afterwards. Okay, is there a motion? Robin moves, second. Sue seconds. Discussion?
Well, I am opposed to Mr. Dick retiring. I told him I would vote no on it.
I would like to add that we have several more donations that have come in the last couple of days, and certainly a big shout out to the community for the support that we've seen. It's been overwhelming with our new scoreboard, so thank you to everyone. And you'll have those on the next board agenda. Yeah, for October.
Very good. Anything else? All right, roll call.
Mrs. Psalm?
Yes.
Mrs. Young? Mr. Rainier?
Yes.
Mr. Sharp?
Yes. All right, next item is public participation. Sarah, I'll let you go first.
All right, well, good afternoon, everyone. I'm Sarah Sharp, and I'm here on behalf of the Amanda-Clearcreek FFA chapter. Tonight, I'll be providing you with a recap of our chapter activities and successes from the past month. So since our last update, we held our first FFA meeting of this school year, And this was actually our first FFA meeting in the Ag Center since our 2019-2020 officer team was in office. So that was kind of exciting to get back there. We participated in our fall Adopt a Highway event, and we cleaned up trash along State Route 159. We had members attend the Franklin County Farm Bureau Field to Table event, where members helped out by taking pictures for attendees and had the opportunity to talk to fellow members of the agricultural community. We attended our first Ag Breakfast of the school year at Frisch's Restaurant in Lancaster, and we're starting to kick off our fall CDEs. So members have started practicing on our upcoming fall CDEs, which include forestry and job interview, just to name a couple. Some of our upcoming important dates: on September 20th is our monthly FFA meeting. September 22nd is Farm Science Review. September 25th is our State Forestry CDE and our Fall Fest. September 29th is the Ohio Legislative Leadership Conference. And September 20th is our Ohio FFA Foundation 5K. So as you can see, we have a lot of activities planned for the next month, but we wouldn't be able to do them without your support. And so I'd like to thank each of you on behalf of the FFA for all that you allow us to do as a chapter.
Thanks, sir. All right. Beyond that, we have 4 people who have signed up for public participation. I will say that we are like a 30-minute limit total, so if you could try to keep it within 5 minutes for each of you, if you could, that would be very appreciated. The first people, I guess, on the list is Bill and Kathy Ball.
Great, so do we get 10 minutes? Stand up. Good afternoon or good evening, everyone. Nice to see all of you. My name is Bill and my wife Kathy. We live on the north side on Ridge Road, so north of 22. You know, when we started this meeting this evening, we pledged allegiance to the flag, and we said one nation under God. Both my wife and I are Christian conservative patriots. That's important to us. Our faith is very important to us. And we do say that we're one nation under God. And what I mean and what I'm getting at with that is that we're all created in the image of God. So it doesn't matter what color you are, we're all created in the image of God. I'll go back to my time in the U.S. Navy. This was way back in the 80s. I was on an aircraft carrier. I spent 3 years on that aircraft carrier in a berthing department, 1/4 the size of this room, with 36 other men my age. Black, white, Hispanic, Asian, and everything else in between. Okay? Not one time ever during that 3-year stint that I did that, living with these other men of different races, creeds, national origins, all that, was race ever brought up between all of us. Did we argue? Sure, because people do that. Okay? So inherently, this country is not racist. In my humble opinion, and I've seen it myself. But I was very concerned. We got on Amanda-Clearcreek's website, and under the Let's Talk portion of it, which is something that, Start Talking, I'm sorry. And it's under the heading of Building a Drug-Free Future. You know, what is Start Talking? And this was by Governor John Kasich and his wife, the First Lady. And that's all great. And you click on that little thing about Start Talking, and it takes you to an Ohio website. And that's fine. But below that are all these things that are on the school's website that are helping parents to get through some different things, talking to teens about sex and all that. But the one thing that really caught my eye was the portion on here about, hold on, I lost it. No to define racial terms for teens. And when you click on that, it takes you to another page to know how to define racial terms for teens. And it even gets down to me, more or less, having to apologize for how I was born because I've got white privilege. And I'm really shocked that that's on our school's website, that people are going to look at that and subscribe to it. And in my personal opinion, the only thing it does is continue to divide us. Okay? Nobody should ever apologize for how they were born, ever. And that's what this whole white privilege thing is about. It's disgusting. It is anti-American. It's anti for what every true Christian stands for. And I think it's something that we need to take a hard look at. Maybe we need to remove something like that from our school's website where many people go to get information. And I'd love to just turn over to Kathy. She's going to describe a couple of things that are in there that are quite shocking in my opinion.
So when you click on that, there's 2 pages and it says, I'm gonna be very brief. There's a lot in here, but, it gives you the terms, defining words, talks about systemic racism, privilege. An example of privilege is including male privilege, heterosexual privilege, people without disabilities privilege, and white privilege. And then the rest of this is all white privilege. So this is what we're supposed to be talking to our kids about. And it says, talking about white privilege can begin to break down the walls of racism. In simple terms, it addresses the everyday, sometimes subtle, sometimes not subtle advantages that white people have over others. I mean, I'm a Christian and I treat everybody as not based on their color. So then you can go on, and then there's this article this woman wrote on that page. And if you research that, she gives you 50 examples of the daily effects of white privilege. And here's just 2 of them. White privilege is, I can talk with my mouth full and not have people put this down to my color. Or because I'm white, I am not made acutely aware that my shape, bearing, or body odor will be taken as a reflection on my race. And then there's another author, and it's a woman, I'm sorry, racism, white people. It says, shut up already and listen to a person of color. And then it goes on and on and on. But at the end of this, there's suggested reading, and that author has a book called How to Rent a Negro. That is right when you click on what Bill talked about, defining racial terms for teens. And then you click on, I don't necessarily click on it, but you bring up what this is referencing, this topic or article, and that is 7 pages about examples of white privilege, and that one author has a book out, How to Rent a Negro, and that is on the AC homepage. And I thought that parents should know about that, be disturbed by it, that we should not be dividing any of our students. I think that is the worst thing going on in the country, is putting people in different pockets. And if you ask anybody, if we just stop talking about it, there won't be any racism. I
We
mean,
can figure it out
I'm sure
as
there's
people.
some, but we certainly don't need that on our homepage.
Thank you.
Thank you.
Thank you.
Excuse me, real quick. I don't want to speak. I just want to ask a question to everyone. Do you guys believe in that stuff? Do you condone that at all? Do you see?
This is not going to be a
people-
discussion item. We're not going to get into it.
Okay, I just want to ask a
Yeah.
question.
I mean, that's not part of the,
Okay,
for tonight. We got other things to talk about. Lee Haynes? Or is it Leah? She's not here. Haynes? Lee Haynes? No? Okay. Corey?
I don't want to speak. I just, shockingly, I thought I've been to other meetings that you have to sign in, and I thought that
You said
I'm just here because I decided that if my kids are here, I should be here. And I go to the Fair Board meetings now. I'm starting to go to things that I think, I've been reading the notes. I think it's really interesting, and so you'll see me here.
Okay.
That's it. Okay, Kyle.
Thanks for coming. I didn't even notice until I saw Elizabeth Corey. Right. Yeah, there she is.
Thank you.
All right, Heather. Wait, no? Okay. Well, that was Sarah?
Nope, just.
Okay, that was Edie. Okay. I don't have anything else, so we will move on then. Next item is treasurer's report.
Okay, I believe at your place, there was a monthly financial report that is from our forecast, comparing our monthly financials to what we have forecasted. It pretty much reflects your board report, and I'll go through that a little bit. We did have one question from a board member regarding real estate tax, which shows to the negative for the month. And that is because we received from the auditor's office tax advances. So if you turn to your 5-year board report, to page 3 of the financial report, second line down, 93,508. We receive advances from the auditor's office, which we received those in the month of July. And then we received the settlement, which is basically a true up for that. And because of the personal tangible property tax, it ended up being negative in real estate and then a positive in personal tangible. So we did actually receive more property tax than we have in past year. It just reflects that true up. So that was a great question. I'm glad you pointed that out. We were approximately $31,554 to the negative for the month of August, which is about half of what August of 2020 was. So that is a good number. Typically, we will see that number to be consistent, and that's the purpose of this 5-year board report, to make sure that there's nothing that stands out. If it does, that we're explaining that to the community and to the board. For the most part, not to read you my summary, but our revenue for the month was about 1.372 million. We did receive casino tax this month, which was $46,272. That has almost returned to its previous. We did have due to COVID, obviously the casinos were closed last year, so we did have a reduction last year in those collections. This year it's returned about to where it was, if not higher. So obviously the casinos are doing well in Ohio again, so that's a good thing for education. The overall, our revenues were slightly less than August of 2020. That was because we received more money in July of 2021. So because those advances were so big, it was only about $8,000, which is basically net zero. Expenditures for the month were $1.4 million, and we wrote checks in the amount of $2.3 million. Are there any questions on the financial report? I don't think there's anything to start.
No, I just have a comment. On these report options, it gives you the option of page orientation as landscape. Can you change those to portrait?
I can, however, because of the size of the report, it makes it very hard to read because it puts it on a separate line. So I'll do that so you can look at it and see what you think, and then if that makes sense, like it will make it multiple pages with several lines for each item.
Instead of going across.
Instead of going all the way across, because it basically, it can't make the numbers, because the numbers are so big, it can't make them much smaller to get them in an 8.5 versus the 11.
Can you make a column smaller, like the fund column and then the 001? I think that takes up like a third of the page and should take up like a 10th.
I don't believe I can adjust those sizes, but I will try. I'll try to see if I can get it into the way.
All right.
That, or I can send it to you that way for the electronic version. That might look a little better than the printed too. So we'll
All
give
right.
you some options.
We'll see. Thank you.
You're very welcome. Any other questions?
Is there a motion to accept financial reports? So moved.
I'll second.
Justin seconds. Discussion, additional. Roll call.
Mrs. Young?
Yes.
Mr. Renier?
Yes.
Mrs. Psalm?
Yes.
Mr. Sharp?
Yes. Superintendent reports and recommendations.
I would like to recommend we approve the classified contracts, cook cashier Amanda Schaefer, Michelle Trago, one-on-one educational aide, Andrew Curtis, substitute custodian, Chastity LaFontaine, Nick Morrison, Jessica Williams, and substitute cook cashier, Jessica Williams and Lindsay Sisler.
Is there a motion? Robin moves. Second. Sue seconds. Discussion. Roll call.
Mrs. Psalm?
Yes.
Mrs. Young?
Yes.
Mr. Rainier?
Yes.
Mr. Sharp?
Yes.
I'd like to recommend we approve the following supplemental contracts: high school football coach assistant David Barnett. And then the board has offered the position of middle school volleyball coach, 7th grade, to those employees of the district who have a license, and no such employee qualified for this position, except that for this position was advertised and available to any individual with a license who is qualified to fill it and is not employed by the Board of Education. That being said, I'd like to recommend middle school volleyball coach Stephanie Sowers. And I do not have the effective date on that. This is very child of that.
All right, is there a motion? Sue moves. Second. Robin seconds. Discussion. Roll call.
Mrs. Young?
Yes.
Mrs. Psalm?
Yes.
Mr. Rainier?
Yes.
Mr. Sharp?
Yes.
I would like to recommend we approve the change in hours for the following cooks, cashiers: Patricia Gillespie from 4 to 5 hours per day, and Wendy Sloan from 3.5 hours per day to 4 hours a day.
Is there a motion? Robin moves. Second. Sue seconds. Discussion. Okay. Roll call.
Mr. Kern, do you want to vote on this? Did you get
No.
locked in? Okay, I wasn't sure how much you heard. Mrs. Psalm?
Yes.
Mrs. Young?
Yes.
Mr. Rainier?
Yes.
Mr. Sharp?
Yes.
All right, I'd like to recommend we approve all volunteers for the 2021-2022 school year: Kyle Hinton for football, Jordan Lazier and Peyton Madison for football, FFA, Allie Poston, Julian Scott, Hoagie Smith, Noah Smith, Joel Spires, and Caleb Bowens. And for classroom aide, Ashley Adair, Jennifer Heyman, Appalachian Brown, Deanna Charlton, Joshua Clark, Angela Doherty, Stacy Dirk, Kayla Dials, Charlene Fisher, Megan Francis, Tracy Hank, Andrew Jarvis, Miranda Mason, Jennifer McLaughlin, Emily Millsap, Amanda Rhodes, Rachel Ridner, Angie Roberts, Lindsay Stapleton, Stephen West, Nancy Palsgrove, Jamie Bickroyd, Becky Heron, and Tony Davis.
Could you repeat those?
Is there a motion?
Move.
Robin moves. There's a second.
I'll second.
Justin seconds. Discussion.
Well, we say it, I just don't want the words. We appreciate all these volunteers. It's good to see this many classroom volunteers back in the classroom. So it's always good to get those people in to help us.
Absolutely. Anything else? All right, roll call.
Mrs. Psalm?
Yes.
Mr. Rainier?
Yes.
Mr. Kern?
Yes.
Mrs. Young?
Yes.
Mr. Sharp?
Yes.
All right, I'd like to recommend we approve the mentors of the 2021 school year as it pertains to the higher resident educator program. And I will present it as a list presented to you as I go into all those names.
All right, is there a motion?
I move.
Justin moves. Is there a second? Second. And Brandon seconds. Discussion.
This is a yearly thing that we must do for our year 1 through 4 teachers. Some of them take 5 years, but we must assign them a mentor to get through the program. So. And the mentor must go through professional development in order to do it. So.
Anything else? Roll call.
Mr. Rainier?
Yes.
Mr. Kern?
Yes.
Mrs. Psalm?
Yes.
Mrs. Young?
Yes.
Mr. Sharp?
Yes.
I'd like to recommend we approve the steps and salary for previously hired staff members Susan Satterfield, Emily Patton, Matthew Sloan, and Lauren Mansberg.
I move.
Justin moves. Is there a second?
I'll second.
Robin seconds. Discussion.
Last time we did not have the steps or the salary amount on the agenda.
Roll call.
Mr. Rainier,
Yes.
Mrs. Psalm,
Yes.
Mrs. Young,
Yes.
Mr. Kern,
Yes.
Mr. Sharp.
Yes.
Adopt a resolution allowing the superintendent to sign written agreements with other school districts to transport out-of-district students with the understanding the AC district will bill for reimbursement of costs. The agreements with superintendent approval will be presented to the board for approval at its next meeting.
All right, is there a motion? So moved. Second? Second. Rob beat you. Probably second.
Is this via school bus or are these like the vans or?
School bus, and it could be a van too.
Okay.
Sometimes one time we hauled Blue Carroll, we had like an FFA group for us to haul 600 bus and then haul 600 bus. We took a bus and hauled it and they reimbursed. It's been a while, but it allows us to enter into agreements if something comes up.
Sure.
Anything else? Okay, roll call.
Mrs. Young? Yes. Mrs. Psalm?
Yes.
Mr. Kern?
Yes.
Mr. Rainier?
Yes.
Mr. Sharp?
Yes.
I recommend we approve the change to ACE negotiating agreement with which the language for teacher evaluation has been redone in accordance with the Ohio Department of Education. OTES 2.0.
Motion. Brandon moves.
A second.
Justin seconds. Discussion.
The leadership team and ACE has sat down, started back in March, and we hammered out new language to do a new evaluation system that matches the ODE's, OTES 2.0 model.
Very good. Anything? Discussion.
It doesn't change the timelines that they occur on, correct?
I'd just like to say that I think that they worked really hard on this. It took a long time. It seems that
It is.
cut a little short of approval for all the hours they spent trying to get that to where it needed to be.
It's a lengthy
So,
document.
It is, so they need to be commended for the time they spent doing it.
Very good one. Any other discussion? I roll. Sorry.
I was over at the Biddy soccer stuff, and I thought I had until 7:30. I guess you already called me to speak. Have I missed my opportunity?
Well, yeah, but
Okay.
maybe we, in between old and new business, I can squeeze you in then.
Okay, I misunderstood. I thought I had 7 to 7:30 to get over here, so.
She can have my time.
I was there. I'm signed up.
You
You
were
called my
signed up.
name. You already
Were
called my
you-
name.
Yeah, okay, yeah.
She said you called my name
Yeah,
already, and
yeah,
so I just wanted.
Okay, well, when we get to, before new business, I'll give you a couple minutes then. Okay, sorry.
Great of it.
Roll call on
Sorry.
item 8.
Mr. Kern?
Yes.
Mr. Rainier?
Yes.
Mrs. Young?
Yes.
Mrs. Psalm?
Yes.
Mr. Sharp?
Yes.
All right, I'd like to recommend we approve substitute teacher pay from $90 per day to $110 per day, effective Monday, September 13, 2021.
I move.
All right, Justin moves. Is there a second?
I'll second it.
Do we know where this puts us with other school districts?
We're second.
Okay.
So,
I know how that game gets
Right,
played
and-
and, you know, you move and then everybody else moves to change theirs. It's a cat and mouse game, but
and as soon as everyone here is in the county by
Yeah.
Friday, they're all calling and say, what are you doing to me? Why did you do this? And I'll say because of
we want substitutes.
we do, and we're going to be competitive, and if we don't, I want you to know, I will bring back language to you in October with something that will resemble what happens if they substitute to it for 30 days, then particularly increasing or 60 days, try to incentivize subs to come and stay.
So this gets us to second.
Yes. I think with Pickerington, no, Pickerington's the highest, I think we're Lancaster, with Lancaster now. So.
Any discussion? All right, roll call.
Mr. Rainier?
Yes.
Mrs. Psalm?
Yes.
Mr. Kern?
Yes.
Mrs. Young?
Yes.
Mr. Sharp?
Yes.
Critical Council meeting report, would you mind doing that, Mrs. Pinkstock?
Sure. So we reviewed testing dates for the year. They are located up here on the bulletin board, and of course, on our website. We talked about the fact that, from preschool up to high school, they have state required tests. And if you would notice those calendars, I mean, there's only a couple of months within the year that somebody's not taking the test. Also, we talked about the curriculum that we're using now, and it's located on the back bulletin board. Those are all the different curriculums that we're implementing from K up to high school. And we discussed each of them and how they help our students, but I think the overall thing to think about is that we are implementing great things for our kids. We've added a lot this year, and I think that we're really on our way of helping reduce those gaps and meet the kids where their needs are. So we appreciate everything that we've been given and the opportunity to use that curriculum with the kids. And then lastly, we talked about a new tracking sheet that we're going to use K-5 to give the data points, be able to pass on to the next teacher so that the teacher before they'll know what good strategies they used with kids and where they were at, and they can hit the ground running at the beginning of the year. And Mrs. Strope also spoke about a new tracking system that Mr. Hinton's going to employ this year. In a rotation period, the kids will all be kind of monitored for high school students, will be monitored for their grades, attendance, and behavior. And because the teachers will have a small group that they're monitoring, they'll be able to pay attention much better to those that need some intervention and then supply that support where it's needed so that the students can be more successful. That was it in a nutshell.
Thank you. Student Achievement Liaison report, Mr. Renier.
So I've been the Student Achievement Liaison for 2 years now, and it's taken me about 2 years to figure out exactly what a Student Achievement Liaison is supposed to do. And I say that because it is not a well-defined category. But what I will say is in going to the meetings and back on the 8th, they had, or actually it was, back in August, was like a virtual conference. It seems an awful lot like one of the best ways for folks to share their student achievements is just, they're collecting the look at us moments. And something I would like to do, it's a little bit of work on the principals, and so I apologize, but it would be nice to be able to submit something to the monthly report that they send out from Amanda. Basically something that we feel is pretty awesome that our students have done. And I can give you some examples of what other schools put forward, but I know that our students are doing some amazing things. So it would be really cool, I think, to submit something from Amanda. Also,
Who will you be submitting it to?
Kim Miller-Smith.
Okay.
Yeah. She's the head liaison, if you will. So I'd like to do that. And then the other thing is I want to revisit some of the things that I had discussed previously, the potential for a JROTC. I know I discussed a little bit earlier with the principals, the app, and how that might be able to serve our students. But ultimately, when it comes to student achievement, I think that the Curriculum Council, which we just had before the start of this meeting, is a perfect example of what the teachers, administrators, and all the staff from the top to the bottom are doing to ensure the achievement of our students. So if anybody ever wonders, like, what is it that the Student Achievement Liaison does? Apparently they report to all the other Student Achievement Liaisons how awesome our school is. Outside of that, it's not like there's really a whole lot to pass on. So I do apologize if it seems like I'm slacking. It's just that I could sit here and read to you what all these other schools are doing that's really gee whiz awesome. But I think more than anything, we would like to hear that from you guys, and then also pass it on and let everyone else see how awesome AC is. So that's all I got.
All right, thank you. We're going to do the building present report while Mr. Turner's away. Amy.
Okay, at the middle school, I'm kind of gonna backtrack a little bit. So last Monday, August 30th, our students had the opportunity to listen to a motivational speaker. This gentleman was very captivating. Our students were very well behaved, and he was very inspiring. And I was able to talk to some students afterwards, days afterwards, even at lunch the same day. and they absolutely loved it. So essentially, he was in an accident in high school. He was he led, I think, his team in tackles his sophomore year, and he was in a factory accident and lost both of his hands and part of his arm. So he showed the kids the prosthetics and took his prosthetics off. He talked about how one day at football, after he got his prosthetic, or I don't know if it was after he got his prosthetics, but how his water bottle was laying on the ground and he asked his coach to pick it up. And his coach said, "You'll figure it out if you're thirsty." And it was that inspirational message of it was all about finding a way. So it was very inspirational for our kids and awesome. Our 9th through 12th graders got to listen to the speech as well at a different time in the day, but our kids were phenomenal. So it was a great opportunity for them. Couple other things coming up at the middle school. I just announced to students earlier this morning via email, and then I talked to them about it at lunch. We are starting an incentive starting tomorrow. So we did this 2 years ago with a dodgeball tournament. But we're going to do kickball. We're going to go outside. We're going to social distance. But it's based on behavior. And it's based on grades and missing assignments. So again, incentivizing the students who have demonstrated what a good ACE is through behavior and through grades. Just a reminder to parents, a couple of things. Interims will be posted in progress book next Friday. So interims will go in this week. They'll be finalized next Tuesday. So that will be posted. And then a couple other things coming up. September 29th, we do have a 2-hour delay that day. That evening is literacy night, K-8. So more information will be communicated to parents, but any K-8 family is welcome to attend. And finally, just a reminder to parents from myself that I do text out weekly announcements. I try to text them out Sunday evening, early Sunday evening, which kind of gives them a glimpse of what's coming up for the week. So just checking that text message, and it's posted to the middle school website as well as Twitter, Facebook, everywhere. So,
Mr. Brosovich.
All right, and the elementary students teachers have finished up their baseline data for STAR and DRAs. These tools are used for our instruction pieces. Our teachers are now in the process of looking at the data and providing an opportunity for a shutdown period for our students. It's a 20-minute period where we're going to have focused reading interventions taking place. 4th grade is underway with our paper recycling program. The teachers in all of the buildings have now green bins in their classrooms to recycle paper. We've got 2 organizations. We've got paper retrievers that we have in the back, and we also work with the Lancaster Fairfield Community Action Group. They had a representative come in today and spoke with our 4th graders and 3rd graders about how they're recycling the community. 5th grade will be exploring band soon. We'll have a band night where they get to, or a band day where they get to experiment with the instruments and things like that, and then have a period throughout the day during their recess to practice with the band instructor. So the opportunity just to experience that. And our mom sales wrapped up today, and our pickup day is September 25th. That will be delivered at 7 a.m. and then we'll organize that and parents can pick up their mums.
Thank you. Ms. Fraley.
All right, at the primary, we've been focusing a lot on our PBIS and our ACEs way cards. We talk a lot about what it means to be an ACE, to act responsible, come prepared, encourage others, and show respect. Right now, we've been motivating the students just to be kind, to do the right thing, even when it's hard. We've had to talk about that. But in the month of August, we gave out 243 cards. So some of the prizes and rewards that come along with that could be something as simple as phoning home, having a short conversation with somebody has been a highlight. Popcorn and Pac-Man with the principal, slushies with the secretary. Others are easy as picking out of the treasure box, chit-chatting with a friend at lunch, things like that. So the idea behind that is just motivating our students to work hard, to want to be at school, and to get excited about learning. Also, our pickup and drop-off has been going phenomenal. So shout out to all the parents for following the grid and traffic and how it flows. So we appreciate it.
Why don't you add soup to the soup with that?
Soup with the superintendent, I like it.
Yeah.
He said it, folks.
Yeah.
Live stream.
Make sure it's tomato soup and grilled chicken. What we do. All right. Mr. Curran, liaison report.
Yeah, sorry. So nothing really new to report. The legislature is wrapping up the recess. This is the last week of their summer recess, and they'll be back in session next week. So at our October board meeting, I'll probably have some more updates as they get back to business. Maybe just one thing that I would highlight, probably for the broader community, but I think it impacts our students too potentially, is in the budget bill, they included some funding for broadband infrastructure development, $250 million worth of broadband infrastructure investments through a new program, and the governor issued emergency rules to get that program stood up in an expedited fashion. So it will be interesting to see if some of the communities here, and we've struggled as we went to remote learning and things like that, parts of our district, there's certainly still a need for additional infrastructure to be put in the ground. So this program is something that we might be able to potentially look at how we advocate for the portions of our community to help with our students as well, be a part of that. So I'll have more updates on how some of that funding will flow, but more specific education updates probably at our next month's school meeting as they get back to work next week. So thank you.
All right, so before we get to new business, Leah?
Yeah, do you mind first?
No, that's fine. We'll give you a couple minutes.
Okay. Justin and I had been talking, and he said he would love to have me come and speak and kind of give my ideas on the masks. And I missed the last meeting. I didn't have the opportunity to come, and I would have spoke then at your emergency meeting. But my name's Leah Haynes. I have a 5th grader and a pre-K here in Amanda. First of all, I just want to say thank you to all of you guys, because I know that you are under unbelievable amount of stress, and I know there's a lot of time and energy going in. So I want to make sure you guys know that you are truly appreciated. And I don't know about everybody here, but I know I'm kind of tired. It's been a really long 18 months. There are days that I wish I could just click my heels and return to a pre-COVID day, but I know that reality tells me that we can't. So we're left to deal and face with the everyday challenges that COVID's brought us. The biggest thing is that nobody knows what the right answer is. We are all pretty much in survival mode each day when it comes to COVID. And the biggest thing that I've tried to instill in my boys is I want you to be the leader, not the follower. And so I'm asking that here in the Amanda School District, you continue with what you've been doing and continue to be leading and allow the mask decisions to be left up to the parents. I believe this is a freedom of choice, and we all know our children and our families the best. And we as parents need to make sure that we're making the right choices for our household. COVID's taken a lot from my family, and I don't make light of the situation at all. I understand that it's a real and deadly disease. I am a nurse. I've been a nurse for 20 years, and I know that the medical community, families and schools, that everybody's divided. Everybody has very strong opinions, and I could tell there was heat. I watched the last debate, and I could tell there was some heat with it in some of the responses. But I believe that masks do a lot more harm in children than good. I personally have to wear a mask every day, the whole day, from the time I get out of my car till the time I leave and get back in my car at work. And I've got severe asthma, and I have to tell you that there are times like I'm constantly feeling like I'm touching my face. And that's, to me, like a chance of getting germs and spreading things, because, normally I wouldn't be. And then, so I'm increasing a portal, spreading those germs. And then I feel like I'm suffocating. I get dizzy at times where I have to take it down and take a deep breath. And it's because I've been inhaling the CO2 all day, and it's just hot. And that's me as an adult trying to handle it. But also masks, they're not covering our eyes, and those are also, your eyes are another portal for mucous membrane for disease. But basically what I'm trying to say is that most masks are not the N95s or the masks from the hospital. Like if I put this mask on, I can't feel any air. But what people have made these masks are fashion statements. And a lot of these kids I saw with like the mesh ones, the sparkles, that they're not really doing anything. They're using it as a security blanket. So I just think that all of that kind of defeats the purpose. And then you've got that false sense of security. And I think there's a mental distraction. My 5th grader, Miss Pinkstock actually had Caleb in 3rd grade, but the mask became a focus, and that's all he could focus on. And then you guys were the leader and went all 5 days. I don't have any friends anywhere else, Powell or Upper Arlington, any friends anywhere that had kids going 5 days a week. But you guys were that leader, and you let it happen. Now the masks he struggled with, But, I lost my train of thought. I just think though that even with, my pre-K has severe asthma and I don't want him wearing one because I've seen him where we've gone into a place, we had to go somewhere and, they were forcing us to wear one. And here he is, he's like, I gotta go to the bathroom. We go running into the bathroom and before I could say anything, he touches the toilet, touches his face, touches the toilet, touches his face. And I'm like, this is with me standing right there going, oh my gosh, don't. Just imagine what these little kids are doing with these masks and touching. And then this is really gross, but my 5th grader, he told me instead of getting tissues last year, he would just blow his nose in it. That does not, I'm gonna be honest, and I don't mean to be gross, guys, but that's why, for me, that my children, it just doesn't do well. Now, maybe I do not judge anyone. If someone feels that they need to wear them and their families need to, then that's great. And that's what I'm asking you to be that leader and to support the parents and the fact that and give us that choice of what's best for our children. And I apologize for being gross, but I'm a mother boys, and that's what they do. Life is real. So I'm gonna repeat it again. We do not know what's right and wrong. We are all truly trying. And so I'm asking with you guys in the Amanda community that we all have a little grace and kindness, because I've seen some really heated things on Facebook and it gets really annoying because I know for a fact everybody gets up in the morning and is trying their best. So we all need to take a step back, take a deep breath, and have a little grace and kindness and love for everybody and realize nobody knows what the right answer is. We just know what we can do for ourselves. So I'm just asking that you keep that choice to the parents. If we want to wear them, let them wear them. If you don't, no judgment. And then with the quarantines, I did hear, I know it's kind of getting complicated and everything, but remember, everybody's back at the school now. And there were quarantines last year. There were things when we just have double the kids in the building now. Parents need to understand that. And then just when I just was at that football field and there was a lot of people there, not one person did I see have a mask on, and the kids are playing and everything. So it's, to me, a struggle. Then you put them right here in this building and they have to wear one, but then they go out. It's very, again, that's that mental, my son, my 5th grader cannot understand it. Why are they afraid of me here, but they're not afraid of me there? We've had these talks and I'm trying to explain to him, they're not afraid of you. They think it's, well, why is it best here, but not there? And that's why I think just putting that control and that choice back into the parents' hands. I don't mean to get off track, but so I'm just asking that when you guys make decisions, use common sense, remove emotion, and just do what's best as a whole. And I honestly would not want to be in your guys' shoes, and I respect you and I pray for you daily because I know this is a really big thing, and I know there are heated and hot opinions on both sides. I want to thank you for being in the role, and I pray more now than I ever have, and I'm going to continue to pray for you guys for wisdom and that we can all come together as a community and support one another and just have grace with each other. So thank you for letting me speak, and I would have been here at the last meeting had I known about it a little sooner. That's it. Thank you, guys.
Okay. On the new business, as we did before, items 1, 2, and 3 are off the table there for this one. Item 4, approve staff leave without pay for Mandy Lindsay for August 6, 2021, full day. That's the only one.
I move.
Is there a second? Brandon seconds. Any discussion? Roll call.
Mr. Neer?
Yes.
Mr. Kern?
Yes.
Mrs. Young? Yes. Mrs. Psalm?
Yes.
Mr. Sharkey?
Yes. Item 5, approve out-of-state field trip request. FFA is requesting you attend the National FFA Convention from Wednesday, October 27, 2021 through Saturday, October 30, 2021, leaving at noon on the 27th. Mr. Tilley will transport students via an AC bus. Is there a motion? Robin moves. Sue seconds.
You know where they're going?
Discussion.
Indianapolis.
Sorry, Indianapolis.
Indianapolis.
Yeah. That's where it's been for several years now. Used to bounce back and forth. Louisville, Indianapolis, but yeah, it's been in Indianapolis for Any other discussion? All right, roll call.
Mrs. Psalm?
Yes.
Mrs. Young? Yes. Mr. Kern?
Yes.
Mr. Rainier?
Yes.
Mr. Sharp?
Yes. Item 6, approved general service contract with LCECS, which is Lincoln County ECS, to provide educational services and special education related services for students with disabilities and/or special needs through cooperative programs, which is attachment 9. Is there a motion? Brandon moves. Second. Robin seconds. Discussion.
Mrs. Lowe, do you want to explain real quickly what this allows us to do?
I'm sorry, I was reading an email.
The Lincoln County ESC agreement.
Absolutely. So previously, we have had contracted services with a company out of Columbus called VIP for vision services at a rate of $110 an hour. We'll be getting this from the Lincoln County ESC as a vision specialist, same qualifications for $56.50 an hour. So the services for our kids don't change. We have a little more control because we get to work directly with another ESC for this, but it is a cost savings to the district. We were paying $110 an hour even for the vision specialist sitting in Columbus, just texting our general education teachers content and things to work with our kids. So.
Thank you.
Is this a one-to-one service aid or is this a?
It actually, we have 3 children currently in the district who are legally blind. And so this actually provides a teacher of the visually impaired to come in to complete their IEP minutes and also their mobility training. And so, for example, one young man uses a cane, and so she takes him out into the community and teaches him to walk, use the curb indentions, different things in the community.
So some of it's one-on-one with students with a disability and some of
Yeah,
it
almost
is-
all of it, honestly, is one-on-one.
And how many hours a week are they here or is it an all-day thing?
It just depends, depends on each individual student and the number of minutes that are in their IEP
Gotcha.
for those services.
Gotcha, okay.
And their needs as regards to, some of them want to walk with the cane, some of them don't want to.
Oh, yeah,
So
yeah.
they-
Not all
they-
3 of them have
Yeah.
mobility in
Yes,
their
sure.
IEP.
Gotcha,
Sometimes that doesn't come until they get a little bit older.
gotcha.
And so, but we do have currently 3 students that the staff will be working with.
Gotcha.
Do we know other districts who are working with?
With Lincoln County, mostly districts in the Lincoln County ESC service area. Our Fairfield County ESC does not offer either visually impaired services or hearing impaired services. And so JB, do you know how long you've used VIP?
That's all I have ever known, last 2 years.
Yeah, so I just did some research around the Central Ohio ESC, and their rate was comparable to the Lincoln County ESC, but they didn't have the staff to accommodate our needs in the Lincoln County ESC did. So it's always better, I think, to use an educational agency instead of an outside, somebody who might be in the clinical model. So.
Anything else? Okay, roll call.
Mr. Kern?
Yes.
Mrs. Psalm?
Yes.
Mr. Rainier?
Yes.
Mrs. Young?
Yes.
Mr. Sharp?
Yes. Item 7.
Yeah, I don't know why that's on there. We reviewed the 5-year forecast monthly report that you added to your place when you came in during my financial. If anybody has any questions regarding it, let me know. I'm not sure why it was again on the agenda. That's my difference. It's very riveting.
So 7A, discussion items. Budget.
So I would, as you can see, the permanent appropriations are not on this agenda. I am still working on those. I'd like to have, and they are due before October 1st. So I'd like to have a brief meeting towards the end of the month to go over the appropriations and then also what is more of a budget for the district. We have made a tremendous amount of changes from 21 to 22 with all the staff that we've taken on, as well as with the grant monies that we have received and how we're offsetting some salaries and purchasing things such as smart boards and things. And I really think it would be a good meeting to highlight those and go over those so there's a clear understanding of what we're expecting for our largest expenditure, which is salary and benefits, and then how that's going to change as our grant monies with the ESSER funds are exhausted. So I'd like to do that in more as an operational budget presentation versus just presenting appropriations. By legal terms, appropriations are your budget, but you certainly don't operate the school district from your appropriations and make decisions from those. So fortunately, being on redesign and with forecasting analytics, we have some tools in our chest that we can use that hopefully will better explain those to you all as well as to our community. So I'd like to establish a meeting towards the end of the month if we could do that. And I'm just gonna say, I'm sorry, Justin. I know how you are.
It's all good. September's a tough month. I can relate.
We did have the first payroll of the school year basically is the 3rd. So we spent a lot of time, Beth and I getting that, and she did a great job, Beth being new to the district in November, like I was. So she did a fantastic job. It certainly did take some time because we have a lot of new people.
If it's all right, Mr. Fairchild, I'll send a doodle poll out
Okay.
with potential dates that we can select from.
Thank you. I appreciate your patience.
Yeah, because I don't have my calendar stuff here in front of me.
All to say is the budget geek, I really appreciate this. Thank you.
You haven't seen the presentation yet.
Hold your applause till the end.
I'm hoping that it pleases you.
We're making progress here.
We had a lot of great things going on. We did have, budget-wise, we did have a consultant come in last week who worked with Mr. Lee. He's spoke with Mr. Dick, he spoke with myself. He's trying to help us put something together that's a more comprehensive plan for capital spending items moving forward. And we certainly will have a in-depth report of that, hopefully prior to the 5-year forecast. It might be after, depending on how quickly he can get some things turned around, but it's going to give us a good overview of what we have, what's going to need replaced, approximate costs, things like that, that we really need to make decisions moving forward. So I'm excited about that too. That's it, I'm done all speaking.
Good. We'll look for the little doodle poll request and come out and see what date ends up working out best. Next discussion item is COVID school exclusion plan.
Just so we're using the terminology exclusion as opposed to quarantine, the Fairfield County Health Department has sent us a letter, basically for us to send out when we now do the quarantining. Since we're not allowed by law to quarantine students, they've given us a letterhead with their signature on to give the students to quarantine. So just to update you, we have 80 students out currently who are quarantined. We have 8 staff members who are quarantined, 6 positive cases in the middle school, 5 student cases in the high school, and 4 positive staff cases in the high school. That's Mrs. Weiss gave me that as of 4:30 this afternoon. So,
Can I ask Mr. Dick, are we tracking how many of those staff members are vaccinated or students who are eligible to be vaccinated are?
I do believe that question is being asked. I do not know that answer. Are we asking any?
When I contact parents in regards to close or contact tracing, I do not ask, I just say their student rent pass as far as the exclusion goes. So if your student's vaccinated, then we pause, and then sometimes they'll say, yes, they are, and then they provide us the vaccination. And then as per the health department, that student is required to mask up for 14 days. But yeah, that question is asked.
Are we asking our staff as well?
Well, the same way that they.
Same way.
Yes.
Go through the flow chart. If you're vaccinated, you pause, and they will answer typically one or the other.
Because we're not allowed.
Because we're not allowed to ask because of HIPAA, are you vaccinated?
So, you mentioned how many were quarantined?
80
Okay.
students.
Do we,
How many were positive of this 8?
yeah,
How
that's,
many students took out those other 80? The 80 are excluded from school because they were exposed, or we have
Yes.
80 that are positive?
80 that were exposed.
And how many were positive, do you know? Didn't Emma check
Um,
that?
yeah, that's what I was looking
Oh,
for.
okay,
I mean, do we
sorry.
know out of those 80, if any of them have tested positive?
Yes, there have been students who we excluded, they would come back with a positive test.
Okay. Would we be able to get those numbers, or is that a HIPAA thing too?
I can ask him, like,
Okay, and were these like just close contacts based on, you know, seating charts, or were these weren't like entire classrooms, right?
no.
Okay.
Go ahead.
Just, so if we excluded some kids and then it came back that they were positive, does that prompt even more contact tracing, or does that mean, yeah, they're.
Yeah, because it depends
It
where,
depends.
and that's one of the reasons that we tried to cut down on the double blocking. Because they have, what, four transitions a day?
At 612, yeah, that's why we did, remain with the block, one reason why we did remain with the block grid. So, Monday through Thursday, students have 4 transitions, at the 612. I should say at the 6-8, they do. I don't want to speak on Mr. Hinton and the high school. But in regard to contact tracing, like, yes, we have had students who, I can say, for example, at the middle school who, going through the health department process and within 6 feet, within 3 feet, putting on masks, you know, and all that. That it depends on when they start developing symptoms. So if we put a student in exclusion and it, let's say on a Thursday, and they start having symptoms on Saturday, we do have to go back 48 hours to contact trace. So again, it just depends. Doesn't mean in all cases, it really just depends on when we talk with the parent when they've had symptoms.
But if you were to have contracted it from Brandon, if you weren't setting beside him every period, then we will have to go back and contact trace whatever period you were setting in beside the new group of kids, so.
And I can say for Mr. Hinton and myself, the first thing that we do is we pull seating charts. So we pull a student schedule, look at the day that the symptoms happen, and then we pull seating charts, and then we physically go to the classroom, speak with the teacher. I mean, I'm taking the tape measure to measure the 6 feet. But yeah, and then before we begin contacting parents, we also check the absence sheet to see, I mean, if that has saved some students from being, you know, going into the exclusion, so.
And I have a question. Of course, we all work with other parents who have kids at other schools. I'm always just interested in what other schools are doing, not that they're right or wrong, or that we are, just interested. And I had a parent today telling me that their student got exposed to somebody in the classroom at another school district. That particular student who was exposed has been vaccinated. And I asked her if they had to wear a mask then for the 14 days, and they said no. They just went back to class. So is that Fairfield County only thing on the 14 days?
That I do not know, but that's the protocol that's set forth by ODH.
Because this was
FDH.
their student goes to a school in an adjoining county to us.
I also thought, so the quarantine, correct me if I'm wrong, the quarantine period is 10 days, correct?
Exclusion.
Yes,
Exclusion period.
exclusion.
So why is the mandatory wearing of a mask 14 days, but the exclusion period is only 10? You could literally have it, be excluded and come back 4 days before someone who's asymptomatic can quit wearing a mask, according to their ODH guidance.
And I don't know the answer to that question.
But I don't, not all schools are clearly following that, because.
Well, we had discussed,
And I'm not saying
Yeah,
they're
we
right or
did.
wrong, I'm just saying this is what other people are doing, and.
we had discussed altering our exclusion plan as well, correct? Based on, I mean, I know you sent out a Google Docs for us to review. I didn't know if that was something that we needed to,
I guess I'm very concerned about stepping down anything that's being asked of us now. I mean, whether, again, we can go political, we can go how we want to. The spread is real. And the best, safest, easiest way to keep our kids in school is mask up. And I'm not telling you gotta do that. I'm just saying, as long as we don't do it, we're gonna have 80 kids sitting on the sideline, I can almost guarantee you the rest of the year. Because there's virtually no way around it. With social distancing as it is, and the guidelines as they are.
Unless, oh, so of those 80 kids, they were masked. They were not masked.
They were not, yes.
Okay.
So the guidelines are, they are unvaccinated, so unvaccinated, they are within 3 feet, so I'm sitting next to Mr. Rostovich, I'm within 3 feet, he tests positive, and I'm in a mask, and still going home.
I'm good though, because I'm more than 3 feet.
If you're within 3 feet and you have a mask, you're still going home.
Yes.
If you're within 3 feet and you have a mask and you're vaccinated,
You
are you
have-
going home or are you staying?
You're staying.
Vaccinated, you're staying no matter what.
Vaccinated, you
Unless you're
stay whether you have a mask or not, am I right?
Yes.
Okay, I thought that there was some, but you have to wear a mask if you were vaccinated for 14
Yes,
days.
if you were vaccinated.
Okay. We'll make sure I'm on the right track with this.
When you get there, let me know.
No, I'm not.
Because,
So my question, are we
Well,
gonna
what the
continue
rules
to
are
send
here.
home healthy kids? That's, I think, the crux of it is, are we gonna exclude asymptomatic healthy kids?
Well,
They're
According
doing,
to
I would just
ODH,
say,
yes.
yeah, they're doing a pilot program in Warren County.
Yeah.
I'm curious to see how that turns out, I guess, where they're not excluding everybody just from exposure. They're
They're
having
just
to wear a
taking the
mask, come
exposed
back,
kid.
but then they're testing them about every other day, which could be a nightmare. I don't know how that'll work out, but
I would think we would need parental
but that was
consent.
a DeWine governor thing that I saw, that they were doing that in Warren County with, I don't know how many schools, but there's a pilot thing to see how that goes, so.
But I think we could say that we're sending home excluding healthy kids now who have come back and then are diagnosed with it later.
Are they all diagnosed
No, no.
with it later?
No, but my part is, none of them, nor do I, have the ability to determine who's going to be sick and who's not,
Sure.
after I exclude them.
Sure, I mean, I agree with you. No one's got that crystal ball. I just, my thing is of those 80 kids that we're excluding, how many of them end up actually testing positive? And how many of them are we excluding from school and possibly setting back in their development and their education? And for what reason?
We don't know if they got it here, if they test positive or not. If we send them home from here, there's no way to know whether they got it from an exposure here at school or they got it at the dollar store. We can look at timeframes, but you can't definitively say.
But as I've always stated, we have a circle of influence.
Oh, yeah.
I mean, that circle of influence is what we can do. And and I'm not trying to be argumentative, Mr. Renier, how many is too many? How many, what number out of the 80 would we say, then we need to mask up?
Yeah, I get exactly what you're saying, and trust me, let me be abundantly clear. I don't wish ill on anyone. I would not want any child or adult to be sick, let alone go to the hospital. That is not what I'm saying. As an elected official, what I can say is my job is to properly reflect the electorate, the folks that have seen fit to elect us. And I'm not saying that we should put this to a community vote, but I'm saying based off of the feedback that I've gotten, and I'm just one of 5, but it has been abundantly clear that parents feel like their students need to be in school and they need to have the choice not to mask if they so choose, or to mask if they so choose.
There's lots of variables, that's the fun part too.
Sure,
There's students,
sure.
there's
We
staff.
can what if it to death.
Right, there's lots of things we consider. That's where I always come back that this is a constant moving target, unfortunately, because the guidelines we get are constantly changing. The virus itself and how contagious it is constantly changing and probably will be forever. I don't know
Yeah, I mean,
how-
where does
unless
it
some
stop?
miracle happens, I'm not
Where
sure how
does
something
it
is solved.
end?
I have
But
a question about the testing. Mr. Dick. So if I'm right, if you get exposed, you can test at day 5. If you're negative, you come back at day 7. If you get
After day 7.
But you have to have a doctor's order because you can't go get tested without one. And if you're
Yes,
asymptomatic,
you can.
not the PCR test,
They're not requiring the PCR test.
to come back, they are.
Go to the health department. to-
Yes, and not only that, you can't, I mean, some doctors will maybe, but a lot of doctors are saying if you're asymptomatic, we're not testing you.
I disagree with the PCR test 1,000%, because the PCR test will pick up a positive COVID for 90 days. And that is not the test that we are accepting here.
And it'll also pick up any coronavirus outside of COVID-19 to include the common cold.
So the PCR, we have to be very careful about.
But that's what the Department of Health is requiring.
Well, last time I saw the guidelines though, when I looked at them, unless it's changed, which again, you go back to the moving window, it said PCR or antigen test.
Yeah, it says PCR or antigen.
No, antigen is not a rapid test. Antigen is a test that they determine whether you have antibodies in your body.
Yeah,
It's not a test you take.
Yeah, the rapid test does not get you out of it. Curiously, it's enough to say that you're positive. It's not enough to get you, even if you test negative, it's not enough, according to the Fairfield County Department of Health, to say you can come out of quarantine at that earlier date.
I understand the antigen is a determination. I've had COVID in the last 90 days, if I still have the antibodies.
That's what the PCR test will show you. If you
I did not know
test
the antigen was
positive, if
considered to be
you
a
are
rapid
positive
test.
anytime within 90 days, the PCR will come back as positive. Almost always. If you've had COVID within 90 days, a PCR is going to pick up on it. So it's not a good here and now. It's a good history, but not a here and now. And that's not what the area health professionals are accepting. They're accepting a rapid test. And I think,
I mean,
do you even,
so I know a student who took 2 rapid tests and was still told that they couldn't come back to school until they had the PCR.
where did they get the rapid test at?
I wouldn't think that where they got it mattered.
I'm just wondering if it was really a rapid test or was it an at-home test?
No, it
I
was
was just
not,
trying
I
to
can
figure
tell you it
out.
was not an at-home test. And then, the other thing is, this virus lives in animals. We're not going to inoculate animals. It's going to be like the flu. And it's not going to go away. There's not going to be a cure for it. There'll probably be vaccines, and there might be, just like the flu, they'll take a stab at whatever strain is going to be. And one of the issues that I have is if we wait for the Fairfield County Department of Health or the Ohio Department of Health to say, you don't have to do this anymore, it's never going to happen.
So the rapid test, I think some of the terms get confused, just like quarantined and excluded from school, guidelines versus rules. The rapid tests are a COVID antigen test.
Okay.
That's what they are. And we are allowing students to return to school with a COVID antigen test.
Because the health department won't tell us when to bring them back.
No. So the health department, speaking again in regards to this one student, even the health department, when this student finally got a doctor to sign an order so that they could go get the test that they needed to be able to come back, the health department called days later to say, you need to quarantine. The negative tests had already been received. But this student, the health department actually said, well, wait, that's awesome. Where did you go to get a test? Because we don't even know where to tell people to go get tests. Because you can't. They said, the health department admitted on the phone that they said, well, if you're asymptomatic, you shouldn't have been able to even get one. How did they get one?
I'm almost sure, I'll have to check, but I'm almost sure if you go into the hospital and you are a person under investigation, you were exposed, you have symptoms, It's an antigen test, it's not a PCR. The PCR test would be like your optional.
Well, that's what when Sarah went and got her test, she was just exposed and she wasn't showing symptoms. And they told her, it was a Kroger pharmacy, and they told her it had to be a PCR test if she wasn't showing symptoms. Now Kylie, I went and got her checked on Monday because she was coughing and had congestion or whatever. I didn't want to send her back to school if I thought that's what it was, but she was showing symptoms. I went to the urgent care over in Circleville because she had symptoms. They did a rapid test, came back negative, thankfully, but. So, I don't know, maybe that's the difference. That's what they told Sarah was the difference, was if they were showing symptoms, they could do a rapid test. If they weren't showing symptoms, they needed a PCR. Although last year when she went,
But I think that's why.
same situation,
Yeah.
she had no symptoms, she was just exposed and we went and got a rapid test and.
But I think that's why the Department of Health doesn't accept the rapid test either, is because if you're getting the rapid test, then you're symptomatic, and if you're symptomatic, from their standpoint, you should just stay home, play it safe. So they don't accept the rapid test to get you out of quarantine early.
But I'm not sure what,
I think if Warren's looking into it.
I think we should accept the antigen test, which is what a lot of the urgent care are doing. And it tells you right on the thing what it is, COVID antigen test.
But we want to be saying that, right?
You don't, but that's why I'm saying like,
I mean, that's the
Well, the
the
guy
frustrating part about this whole situation.
It's either a
is the
PCR
Health
test
department has
or it's
kicked it to
not.
us to make the determination that we have to remove the kid from school, but they have the say of when they can come back. I'm sorry, folks, that is wrong. It is wrong. It's wrong that they're making our administrators do this. It's wrong that our administrators have to spending time doing contact tracing. It's a bunch of bullcrap.
Yeah.
And we shouldn't be doing it. I mean, if they want to take on that responsibility and enforce the guidelines and the standards they
Let them
put in
come out
place,
and measure.
and let the health department do it. I'm sorry, like, that's my biggest frustration, this whole entire thing. And it's just not right. It's not right.
well, that was kind of my question. I didn't get around to my question because we got in the debate over rapid or PCR versus antigen, but my concern is of the kids that we're sending home. Number one, can their parent afford to get them tested? Because you don't just walk in and it's free. And are they staying home for 14 days because they couldn't get a test when they really could have been back in 7? You see what I'm saying? Like if they could have afforded a test or found a place to do the test, they could have come back earlier.
That I do not know the answer to with regards to the finances of families and.
No, I know, I'm just saying, like, I don't like that burden to a family of somebody who just happened to be in the wrong place at the wrong time for more than 5 minutes.
And to that end, if they're asymptomatic, I mean, do they have childcare for this child? Do they have, I mean, I know that we can, over that exclusion period, we can set them up with Google Chrome and Chromebooks and whatnot, but is there somebody to stay with that child and guide them through that? Or are they going to a babysitter that's just gonna sit and say, good luck with that, or,
But I guess to answer the question,
that is rhetorical. I mean,
if a family's concerned about it, then they probably mask them up, because if you don't have babysitting figured out, I mean, I can't keep them here because someone didn't want to take care of babysitting purposes.
Mm-hmm.
I mean, when you decided not to mask them up, that was a chance they took.
Well, I'm confused when the example of they were masked, but within 3 feet. So how successful are we at keeping them farther than 3 feet if they are masked?
I would say social distancing, we work at it every day to make sure that is maintained.
So if that leads to, if a parent is asking their child, mask up, and the kid does it, then we can say, no, we're not sending them home.
Except for when they're within 3 feet for a period of time.
We're just saying that we're not going to have them.
Well, again, you would hope you can keep 1,600 people apart 3 feet at all times, but that's not.
For an aggregate of 15.
How long do they have? Isn't it like 15 minutes?
Yes.
All day.
Yeah, Yeah, that would be.
K-5, that's
If
impossible.
that's up to the administrator or the teacher to say, were they within 3 feet for 15 minutes? There ain't no kid in that class that's within 3 feet of the line.
We
I don't
have,
know. It's just, when they get down to that nitty gritty, when we talk about the health department's not doing it, if it's up to us, and if a kid's doing their best, they've got a mask on, we gotta keep them in school if they're not sick.
I'm just, so is that what this board's directing me to do? Because,
Yeah, it's just-
because I just think we gotta be very careful when we just flat out go against guidelines.
Well, I know it goes back to what you said at the last meeting, which is, if you go to the top of the hill because we ask you to, you better turn around and see 10 eyeballs right behind you. And that's a fair statement. That's a very fair statement.
Have any of the other schools put the burden back on the health department and said, you do your contact tracing? It's your job?
That conversation took place over the weekend with the school district and the health department, included in it. And I think they're doing exactly what we're doing. It's, the health department's not sending any help out here. They just don't have it. And I tried to explain to them on Friday that I don't want to think we have extra help laying around either. And one of the last things I said to them on Friday was, I said, stop changing things. Because I always use the example, just when I know all the answers, they change all the questions.
Yeah.
And just when we have a routine down and we're able to follow it and be productive and efficient, that they change something for us, and it just becomes more and more burdensome for the administrators.
And in fairness to you too, Mr. Dick, is, they're changing the goal, they're moving the goalposts constantly. We have questions and concerns. And then the only thing that's gotta be frustrating for you to basically be stuck in the middle. It would be nice if the Department of Health would talk to the boards, not just us, but the whole county, talk to the boards.
Yes.
Let the boards engage with the departments of health directly so we can have that opportunity to ask those questions, voice those concerns.
Yeah.
Have some kind of, because I feel bad for you having to be in the middle of, them and us, and, we're the ones that set the policy, they're the ones that set the guidelines.
Because ultimately, I'm charged with student safety.
Right,
and
yeah.
health.
Sure.
And the best way to figure that out, or to keep them safe and healthy, again, it's not, someone along we have to move off the political side of the masking piece. It's got to be moved off of that and say, this is what's best for kids. This is what, because again, when we talk about parents come in and say, I'm concerned about my child's mental health and being home and not being here, and not having this and not having it. Well, as long as we don't mask them up, we're sending them home.
If they're healthy, I think that's wrong.
Yes.
If they're
I don't know
healthy,
how I determine when the day I do it, if they're healthy or not. That's my question. I don't know how they determine on a quarantine that today they're healthy, tomorrow they're in here and they're sick.
I think you do it the same way you do the flu. If they come in and they're healthy, they go to school. If they come in and they have symptoms, they go home. I think that's just, I'm one of 5, but that's what I'm saying, is I think you treat it like the flu. And the thing is yes, our jobs, our charge is to keep kids safe and healthy, and we do that. And we've had people from both sides of the debate say, this is what's safe and healthy for my child. And, I will say, I looked at the ODH website, and the one study that they had on wearing masks was done in Sweden, where the students wore the mask for 30 minutes. It didn't study children wearing masks for long periods of time. And I don't think anybody really knows what the ramifications are of those from a physiological standpoint. I think there's probably enough evidence, at least anecdotal evidence, if you ask parents, what it does to their children from a social, emotional, developmental standpoint.
Where's the largest portion of our aggregated 15 minutes occurring? Do we have an idea, a rough idea?
Breakfast, recess.
So what are there strategies that we can
Well,
employ to minimize
They have
contact during those periods?
they've got lunch table spread out, people sitting at opposite ends of the lunch table staggered, so they're not across from each other. Obviously, in the classroom, we're trying to eliminate the example that Mrs. Cochran and Mr. Bostic showed there, so that we don't have to worry about quarantining either one of them. And so that, and to Mrs. Cochran's point about carrying around a tape measure is just ludicrous. I mean, because at 37 inches, you are not exposed, at 35 and a half, you are. I mean, that's the part that drives us nuts in regards to.
I'm sorry, Mr. Dick. I also think it's equally ludicrous to think that our administrative team is looking at surveillance video of our kids walking down the hallway and trying to determine how close they are to someone who's been made, like, that's equally mind blowing to me, right? I mean, the idea that we're measuring out stuff like that is one thing. I mean, it's great, but to think that we are literally watching surveillance video of our students throughout the day. And that's what our administrative team is having to do based on what's been thrown at us from the health department to determine this aggregate 15 minutes. That's mind blowing. I mean, what are we doing?
And it's
have
possible
other
to get it
things
even
to
if
do.
you're wearing a mask and even if you're vaccinated or both.
I don't know. I have a hard time grappling with the fact that our folks who are hired to run our school buildings and help our staff be the best staff and the teachers they can for our kids are spending time doing this stuff. It's really hard for me to stomach, honestly. And I understand where you're coming at. I mean, the easy thing is we just make the decision to put masks on. But I mean, I look at parents are making decisions for their kids right now. And if maybe I'd be more open to it if I thought that we were somewhere close to like a 50-50 breakdown on parents making the decision that it's important for their kids to wear a mask when they send them here. And then the other 50% is creating like this conundrum where we're not doing the responsible thing. We're not being totally safe, and half is doing one thing and half's doing another. But it's not even close to half, right? I mean, I've just kind of observed. I don't think we're anywhere close to half of our students being masked up. And I think it continues to be.
At the primary, we're under 30.
Under 30 kids, 30%.
Under 30 kids that are wearing masks.
Yeah,
Mr. Rostovich, what do you?
I would say there's less than that in my building. But I also want to make a point here. 2 weeks ago, before we had our meeting here, in my building, I can't speak for you, but I think that's the data that's being presented. The wave kind of going through my building. Is that wave gone? It's now in the middle school, high school for the next couple of weeks. All the academics came in. Students are outside with their athletes and playing. Is that the wave going to go away? I'm just making observations from what just went happened. So I don't.
Yeah, me personally, I'm kind of at a point where, I know we've made some adjustments and don't do anything knee jerk and kind of see where some of these adjustments still pan out over the next few weeks or so. And if we get to the point where we're still having as many or more quarantines, then we have to think about something eventually, because whether you like the masks or not, the main thing I think in general that we can all agree on is the best thing for the kids to be in the classroom, as many as possible. So I'm all for, well, and kind of like you suggested too. I mean, the wave goes through, then maybe it ebbs for a while. And so, and I appreciate the idea of leaving it up to the parents to make that decision for now. But I think where we're at and where it's been and where it's going to be is trying to find that fine balance of how can we, leave it up to the parents to make that own decision as best as possible, as long as we can, while at the same time trying to make it as a functional school experience for kids in terms of not in quarantine in a way. And I don't know how easy, to support what Mr. Dick was saying, the idea of going against the health department guidelines opens up a potential big can of worms in terms of if somebody gets sick, and God forbid somebody doesn't just get sick, but they get hospitalized or worse, and then they come back and they say, well, you weren't going, not only we're not following masks, you weren't following the guidelines that we gave.
Certainly, that would be awful. That would be awful. I think that there's also a burden of proof there that they contracted it at school. And, you know, a lot of folks that I see that are masking at school, and I've talked to students, specifically, I talked to quite a few students at football games and at soccer fields, and I ask them, you know, hey, I'm just curious, do you wear a mask at school, yes or no? And a lot of times when I get yeses, I say, okay, just curious, because you're not wearing one now, why do you wear it at school? And the sole reason is not because they fear getting the virus, because they're standing in front of you talking to you right there at whatever event, extracurricular it might be, without one on. And it's because they don't want to be excluded. They don't want to get excluded. That's it. That's the only reason. So what message does that send to our kids? And at the same time, I mean, you know, I understand exactly, Mr. Dick made a great point, which is no one has a crystal ball. So when you have close contacts or exposures, how do you determine who is going to get sick? And I think that's a very fair and valid point. You have to flip that on the other side of the coin though and say, okay, well, how many of these are we sending home that aren't going to get sick? And what, you know, are we doing service to them? And you know, it's just, to me, again, you're right, this is a complex issue. It's evolving. It's not simple.
Yeah, I haven't heard with the pilot program in
Warren County.
I haven't heard how long of a process they're looking at for that. I mean, I would be curious to kind of continue where we're at, unless things get real crazy with exclusions, but continue where we're at and kind of see where that goes. Because, I mean, I'm all for the idea of not having to exclude as many kids as possible. And, you know, you hate sending kids home that aren't necessarily going to get it. But I will say, and I don't know for certain, I haven't seen the numbers, but I know last year it seemed like when we did have kids that got sent home, I don't know that we ever ended up with one
actual positive case.
That you could say, you know, this kid was exposed here, and then the next day, you know, 2 or 3 of the kids that got sent home did. I don't know if that happened last year at all, but I'm fairly certain it's happened this year already. Yeah, so it's clearly more, well, I mean, all you gotta do is look, it's clearly more contagious of a situation than it was before, than it was last year. So there's that bigger threat. But at the same time,
You have to look too, that some of them were high school kids, and that may not have been the only exposure they had to the person was here at school.
Well, and
In the physical building, because we're going back to being social people again, and we're going out with our friends, we're going to ball games, we're sitting in each other's cars after school.
That's a big part of the equation for me, quite frankly. Our society is open back up, right? We cannot control what those kids are doing outside of the school building during the school day, and they're just as likely, quite frankly, I think, based on their after-school activities and what they're doing with their families and going back out in the community to contract it in the greater communities that are in here in the school building. So, I mean, at least we're doing social distancing and trying to control the environment, you know, somewhat here. You know, when they're out with their friends or with their families or going to family gatherings or going to the movie theater or doing whatever they're doing, there's, you know, there's not a lot of that going on. So I think it's unfair to put the burden on schools to say you have to control the spread, because we are by far not the only factor in that equation for where they can contract the virus.
And even the tests don't tell you that you have COVID-19. It could be you have the common cold. It could be you have any of the other coronaviruses in that coronavirus family. And yet we treat it like it's COVID-19, and then, you know, everything that comes with that. It kind of goes back to that question, can you get just regular sick anymore? Can you get just the cold and stay home and no one else has to quarantine?
Well, one thing I thought was interesting, there was a story in the Columbus Dispatch yesterday, or maybe it was today, I don't remember, but it was about how COVID was spreading in the schools or whatever, the specific example they gave from a parent who had 2 kids who got excluded from school was that they'd gone to the doctor and they didn't test positive, but the doctor told him, well, they've got all these symptoms, so just assume it was COVID.
Yeah.
And I'm like, and you're actually using that in the story to try to get, it's like, I'm sure you could find an example of somebody where it actually did, but to actually say, well, the doctor just told him it was, you know, had the symptoms, so let's assume it was COVID. Actually, I brought the story with me. But I'll see the highlights, you gotta be kidding me. It's like, how often does that happen? But anyway.
And maybe I missed it, Mr. Dick, on the 80 students that are out now, Do we know the breakdown of what building they were in? Are we seeing it more in the little kids, middle school, high school, or is it just kind of a mix? I'm just curious.
15 students at the primary, 8 at the elementary, 35 at the middle school, and 22 at the high school.
So predominantly middle school and high school where they're more social.
But I will tell you, if I was a betting man, we have more high school kids masked up than we do anybody else in the building.
So of the 15
Oh,
at
yeah.
the primary, do we know how many are positive?
No. There are no positive student cases at the elementary and primary school.
Okay, so no positives at the elementary or primary currently.
Then how those kids get excluded?
When they call and say, I've been exposed to my grandma,
So those, okay, so the elementary 15 are just students whose parents have chosen to keep them home because either they
they haven't
have.
chosen that.
Huh?
They haven't chosen that, they've been
Yeah,
exposed.
They weren't given that choice.
So did the school exclude them, or let's say the grandma got it or whatever?
I misunderstood that
Yeah.
answer then. You said there were 15 of them, but none of them had tested positive in the K2.
That's correct.
So did
How'd
one
they
get
get out of school
exposed
then?
to a family member, for example, and then 14 others had to go home because that kid?
Or there could have been 15 who were exposed to family members.
They were
Okay,
exposed to
so-
something that was acute.
But we excluded them or their families chose to exclude them? I'm confused.
Once we get word that they have been exposed, we exclude them,
Whether they were
whether it was
exposed here or
our
not.
kids or not.
Whether they were exposed to or not, whether they're symptomatic or not.
And what do you consider an exposure? What does the all-knowing Circle County Health Department say is an exposure? Like these 15, what, do they live in a household with somebody who is positive?
I do not know what they use, but that would be one criteria, I can assure you. Because when I read Lily's list, it talks about who was exposed, whether it's grandma, aunt, uncle. Now, I do not know what they use for determining the exposure time.
Okay, so in the K2, we have 15 kids who are out. We don't know that any of those really tested positive. They were an exposure somewhere outside of our school building.
That's correct.
Got it. Whew, that was complicated. But now the high school and the junior high, are they more, they got exposed, somebody came and then found out later they were positive and that triggered a bunch to go?
So that's kind of what I want to say. So again, I'm not a medical professional.
No, I'm
by
just
any means,
curious.
but- So let's say a student, they're out of school, they get tested, the test results come back, we go back and we do contact tracing for 40 hours.
Yes.
The exclusion starts from the last day of exposure. So even though it's 10 days, those kids put them in school for 2 days while we're waiting for a test. If that makes sense. So students aren't necessarily out of school for 10 days. Again, it could fall over a weekend.
Right.
And that's counted as well. But I'm just saying this because I've experienced this the last 2 years, and honestly, had I known back in 2018, when I was offered this position and accepted this position, I would have not believed anybody that this was gonna happen, but I know I live this every single day, and just like these guys, but for the past 2 years, I've lived this, and, you know, we do have students who, and I say this honest truth, that, have been exposed, have gone home, and I'm getting phone calls from parents or Emily or Stephanie, and they have tested positive. And I'm not saying it didn't happen last year, but we're seeing more rates of that. And I actually go back, just out of curiosity, I go back and look at seating charts and look at where, I know where the exposure happened. And we're talking about kids that are sitting next to each other in class, or sitting close to each other in class. Because I just out of curiosity, I just want to look. So again, I'm not trying to influence anybody's decision, but I've lived this the last 2 years, and I understand we need our kids to be in school, but I do fear that by not excluding kids and not knowing, we could have a disastrous effect of more kids testing positive and being sick, and not everybody going back to have more tested positive from an exposure or from a what's not quarantine, I forget the word I'm looking for. Exclusion, yes. But we'll never know that because some parents are not testing their kids, and that's fine, that's their choice, but we're never gonna know those numbers. I'm looking at a ton of, I had Mrs. Hedges run reports for me, just out of curiosity, 2019, 2020, 2021, so pre-COVID, started COVID, of absences, and our absences right now are what we would see in a typical flu season back before COVID. So we have a lot of students who are sick that I don't know if they have COVID. They might not be getting tested, and again, I'm not saying right wrong, but we'll just never know that. But we are experiencing way more absences than typically in August and beginning of September. And not including excluded.
Oh, that's
Like,
what
I'm
I'm
not
not
saying,
The kids that are excluded, you're not counting them as.
I mean, they're counted in the numbers, but I'm saying, like, when I'm looking at the daily reports of the absences, a lot of kids, parents call kids off sick.
What I will say is that, in talking to a lot of parents and being one myself, I think a lot of parents are petrified of sending their student to school if they're even remotely not feeling well, which is, I mean, that's good. Maybe that, people are starting to take a good hard look, because I'm sure in years past, you could say, well, there are plenty of people who are willing to send their kid to school with a runny nose, sneezy, coffee, 99-degree fever, whatever. That might have flown in past years, and now it's not. So people are paying, hyper close attention to that, I would hope. Some. One thing I think is important, though, to remember, too, is we are focused heavily on what we can observe and measure. But what we can't neglect are the things that we can't observe and measure, at least as a board or staff, but parents can observe and measure it. And that's I think, why we continue to hear resoundingly from so many parents, like, we want our kid in school, don't exclude them if they're healthy. My kid doesn't do well on a mask, don't make them wear a mask. I think the reason is because those are the people that can observe and measure the effects on their student, where we can't to the same degree. And this is there's a name for this fallacy. I don't know what it is, but it happened in the World War II in the Navy. Every plane that came back, and it was all shot up, and they looked at where the bullet holes were to say, where do we need to put armor? And so they put armor in these few spots where all these planes were coming back with bullet holes. And you know what they found? It did nothing to increase the survivability. Why? Because what they were looking at was what they could see, measure, and observe. X number of bullet holes in these spots. The problem with that was, that's the places where the planes could survive. They could be hit there and still come back. The planes that weren't coming back, the ones they couldn't observe and they couldn't measure, were the ones that were being hit in all those other places where they didn't see bullet holes, because those planes never came back. And that's what I fear for our students. We're measuring how many days that some kids are out. We're making, assumptions, and we're all making assumptions, myself included. So I'm not saying one group is and one group isn't, but I think that we just need to keep mindfulness of the fact that we have things that we can measure, like days missed or number of cases that are positive. But what we have to remember that's also important, and lots of parents apparently would argue equally important, is the things that we can't measure, that we can't observe, that they have a better understanding of.
But I would tell you, eventually, the quarantines will be the point that I'm not sure if we have enough staff.
Sure.
When I had 26 out on Friday, it becomes very difficult, again, for those three over there to figure out where I'm gonna find somebody can fold a mirror and put in front of the classroom.
It's a definite limiting factor.
So when that happens, I'm guaranteeing you're all gonna hear about the same people who are complaining about, why are you sending my kid home? We pay taxes to have him educated. I mean, you can't have it both ways.
Sure.
You can't have it both ways.
We had 26 staff members.
Yeah, I think to me, the biggest thing for now, of course, like I said, it's a constant moving window, and where I'm at in terms of being okay with and was beginning the year with the mask optional thing, is that because no one wants a kid to get sick regardless, but at least from what I've seen so far with the COVID thing, when kids do get sick, it's not as severe as it is with adults. Now, obviously, there's more cases now. There seems to be more cases of kids getting sick, but I still haven't seen anything that's come out that says when they're getting it, there's more of their hospitalization rate and that sort of thing per case is going up. So that's where I come back. If we can all talk about this now, but if it gets to the point where it comes out where, more kids are getting sick, but more severely, then it's both. that's why in my mind, I'm still, I'm at least, good about having the conversations because kids don't get impacted by this at a severe level as what adults do. And so, but I only say that because I don't know who's watching out there or whatever, but I know there's been people suggested, well, you don't care about the health of the kids, you're just talking about this. So well, certainly we do. The only reason I consider it is because kids, as of right now, again, with research, from what I've seen, all the stories I've read in papers and everywhere else, they're not impacted as severely as adults are. So that's, I even brought a thing tonight that with me that was a thing from that said that, symptoms with kids and how they are impacted. Is it really any different than your flu and so forth? And we haven't masked up for flus forever. So that's why I'm not wanting to be knee jerk, willing to see if we can get this under control with some of the things we put in place and still allow that opportunity to let, parents decide. And I know you mentioned with the high school kids, I would, sadly enough, I would say, if you're on a sports team, wear a mask, because if you don't want to have to miss a game or whatever else, that's your best chance to not have to miss that. And that's not whether it's a good or bad thing, it's just the reality we live in. So,
I just want to make sure I make myself clear. I don't want to sound like I'm blaming the staff if we ever have to close down. It has solely to do with numbers. I mean, it has nothing to do with absences in regards to how many are not. It just has to do with the fact that
Oh, no, absolutely.
I don't have enough.
Yeah, you can't find bodies and stuff to put in seats because people are sick. That's
that's a very legitimate thing.
Anyways, lots of discussion. We don't have a motion to do anything on here tonight. I think it was, unless somebody's got some different ideas, but it's just more conversation and so forth and see where things go. That's kind of where I'm at anyways, in terms of, I'm all about, we've made some exclusions. Like I said, a week or so ago, with the elementary, we were having a lot of trouble with, not so much right now.
I had two questions.
If the numbers get worse.
I had two questions. I think I already know the answers, but just for point of clarity, because someone had asked, we don't test students here, correct?
That's correct.
And we also do not give vaccines to students here.
No.
Okay. Like I said, I was like 99.9% sure of that answer, but someone wanted me to ask, so I said, okay, I'll ask.
The health department has asked about being a center for vaccinations. That was way back in late spring. And there were so many places opened up throughout the county. I said no.
Well, what I told parents is, their students have to, that's a medical,
Yes.
thing. The school's not gonna just perform a medical,
Well, they did in 1968.
Yeah, well, I like to think we've come a long way since then.
Well, I think one thing coming out of this, why does the automatic resolution to this just have to be exclusion from school? I don't really understand that. In terms of pushing back on the health department's guidelines and start to question them a little bit about why can't there be a symptom check and testing regimen for students who have been within that exposure distance and are at risk, for potentially contracting the virus. I mean, that's how we should look at this. The problem is we automatically look at someone who's been within that range where they're higher risk of contracting the virus as having contracted the virus, and it's not necessarily the case. So why isn't there some middle ground here? It makes sense to me where you would have kids that have met that requirement. Instead of sending them home, why aren't we testing them when they get to the school building? Or not, maybe not testing, but doing at least just like symptom check.
Yeah.
Like we had symptom check stations just to get into the school building an entire year last year, and we have none of that now, right?
Yeah.
Everybody's like, so even at a bare minimum for kids who have been in the exposure range, why wouldn't you have a symptom check protocol to allow them to still come to school, right? That seems like a common sense middle ground approach here where we're allowing kids to come to school, but we're also like a little bit of extra protection against.
And to that end, when does it end? I mean, to that point, at what threshold is that stuff no longer necessary? Are we gonna be doing the same thing next year?
Yeah.
I mean.
Well, I mean, we are,
still in a pandemic, and there is special circumstances, I think we have to try to account for. So I think I had some common sense middle ground, is not necessarily a bad thing.
Yeah.
But
I would guess the pilot thing probably does something like that.
yeah,
And I did hear that there's this
I don't know all the
Yeah.
details, but.
neighboring county that's doing something like that.
Yeah.
Instead of sending, and it's not Fairfield County, so I don't know what those requirements were, but they are that classroom with those students that were supposedly exposed. They come in and they get screened by the nurse, and I don't mean testing,
right, not testing, just
Yeah.
symptom check.
symptom checks, that's.
I can certainly ask the health department Friday when we talk about looking at that consideration.
I'd be curious, to ask them too with that pilot, what they know in terms of what's the time frame of that, like when or how long are they, at what point are they gonna know or accept some results from that could be useful as well? I mean, they probably don't know anything. Maybe they will, but it doesn't hurt to ask.
Sure.
But I would be curious if I said, all I've done is, read anything in the paper or whatever. So I know it exists, but I, didn't talk about a month or 2 months or when they're hoping to get some results from that. So I don't know if the Department of Health people have any. Anything else related to that conversation?
They're advertising, I've seen where they're advertising that you can pick up COVID testing kits at the libraries, or the Department of Health is having you do those. I think Burn Union might be what they're using, that they're sending home with their kids.
We have take-home tests.
But,
Now,
and you do it online with a
Yes.
healthcare provider,
there's a QR code that you have to follow along with.
but those are rapid tests.
Well, that won't get you back from quarantine.
Those will get you back to.
Those won't get
So
you
what's
back.
the point?
Just
It's
so you
enough,
know.
it's enough if you test
What's the
positive.
point?
Just so you know.
I'm sorry, I should've-
If it's positive, they'll take that as a positive, but if it's negative, it doesn't really, they don't count it as a negative.
Okay.
That's basically a waste of time.
Yes, like you're just the bearer of news. That wasn't rolling by.
That's okay. Yeah, no, you're fine.
I'm just like, okay, you're right.
Let's move on.
Discussion, matching bus rider and in-person protocols. I guess that is still part also of the same conversation.
It is, but I think it's a simpler conversation, personally speaking. Whatever we decide to do in the building should probably go for the school buses. And in my opinion, it's foolish to mandate it on the buses and then allow kids to come to the school and not have it. It would be equally as foolish if we mandated kids have it in the building and then say, but you don't have to wear it on the school bus. So it's inconsistent regardless of how you look at it. And I don't feel like the CDC has any say over us. I don't think that they do, other than, the insurance implications, which I'm more than happy to look for a new insurer.
I think, to me, it kind of comes back to, again, the concern with the number of exclusions, because, in a classroom, we can spread out a little bit and not have quite so many. On a bus, you're kind of stuck until you can't spread out bus seats.
And we did ask legal
so-
counsel, and they advised us to mask up on the bus.
The difference to me is, and again, if we're in the existing exclusion issue, if you're on a bus and you have an exposure and the kids are on the bus are all wearing a mask, you've got 2 kids that have to be excluded. If nobody's wearing a mask, you got 11.
That's if they're symptomatic.
So I kind of go,
though.
well,
See,
I
that's if
know,
they're
but I kind of go back
symptomatic.
to.
This goes back to, do we send
Well, again,
healthy
trying to
kids
get-
with the symptoms?
Right.
And how do you prove they got it on the bus and not at school?
Yeah, the medical, how do you prove kind of things is beyond our discussion. I just think that it's a shorter period of time, and we did ask for an opinion. They gave an opinion. Whether or not we agree with it, that's really not for us. Legal opinion. I'm not a lawyer, so I say keep them on the bus. I like the comparison of 2 versus 11. I'd rather have 2 excluded.
To me, that kind of comes back to, again, to me, right now, it's all a matter of trying to find that balance of how can we keep the most kids here in school
Sure,
while trying to ensure as much safety as possible.
sure.
And if they're on, again, because again, we can do some things at school, we can
Yeah.
spread them out a little bit, but we can't spread school bus seats apart.
Right.
So,
I hear what you're saying. I just, when all you have is a hammer, everything looks like a nail. I would expect the attorneys to be risk averse and say, just do whatever's going with the flow, don't rock the boat. I would expect the Fairfield County Department of Health to say, do whatever the Ohio Department of Health says. I would expect the Ohio Department of Health to say, do whatever the CDC says. To me, it's just another entity in a string of entities that's saying, let's just let someone else bear the responsibility of this decision-making process. But thanks for discussing.
yeah. All right. No other discussion items? The next thing is to approve motion to enter into executive session here. Thanks about a public employee from a community member. So, move second. Robin, is that a yes?
Yes.
Yes.
Robin seconds. Discussion, roll call.
Mr. Hearn,
Yes.
Mrs. Psalm,
Yes.
Mr. Rainier,
Yes.
Mrs. Young. Yes. Mr. Sharp.
Yes. All right, there will be no action done of any sort after this, so unless you want to stick around for our exciting motion to adjourn when we're done, you're welcome to leave otherwise.
How's that going?
Mr. Dick.
Yes.
Oh, you're staying correct.
Oh.
That's my assumption.
End stream. End stream.
Yes.
Thank you.
That's the military.
Yeah, normally governor's body.
Okay.